Come in.
Hi Victoria, I'm Lydia. I'm going to be your nurse for today and I'm just doing a head-to-toe assessment. Just going to wash my hands and close the curtain to provide privacy. Can you go ahead and tell me your birthday?
8/31/95.
Okay, I see it. Okay, thank you. Do you know where you are?
The hospital.
Okay, and what's the year?
2015.
Okay, who's the president?
Barack Obama.
Okay, so the patient is alert and oriented ×4. Do you have any allergies to latex? Okay, so I'm going to start my assessment on you and I'm going to have to touch you, okay?
Okay.
Are you in any pain?
No pain.
Okay, so first I'm just checking her head and assessing for any lesions, any parasites, irregularity. Her hair growth is normally distributed and nice and thick and no signs of lice or parasites. Her face is symmetrical and her skin is warm to touch. No bruising, no sign of grimacing, symmetrical. And now I'm going to check your eyes. Okay, can you look into the light? Okay. Alrighty, and then her conjunctiva is pink and she has her eye pupils are round. They react to light, they're pleura. And can you follow my pen light, please? Okay, excellent job. Now I'm just checking for anything in her mouth that might be abnormal. Okay, so all her teeth are in place. Can you smile? Okay, there's no signs of bleeding in her gums. Lift up your tongue. Okay, so there's no lesions or any bumps or anything on her tongue, and her mucosa is nice and pink. Can you say ah?
Ah.
The uvula retracts and she's a 2+. Moving on to your neck. I'm going to feel your carotid artery one at a time. Okay. Excellent. And now I'm just going to listen with the bow. And just breathe normally in and out, okay? Okay, so her pulse is a 2+. Her trachea is midline, and moving on to your hand, your upper extremities. So bilaterally, they're equal. There's no bruising, no signs of lesions. Her skin is warm to touch. Her hair is normally distributed. Can I see your palms? Okay, so nothing on her hands. Capillary refill. Capillary refill is under 3 seconds. And then can you go like this? And no signs of clubbing. Can you grasp my hands? Okay, so she has strength in her hands. Going back to your face, can you smile? Okay, and puff your cheeks for me. Okay, so cranial nerves 5 and 7 are intact. Now we're going to move on to your lower extremities. So I'm just going to feel your legs. Okay, and so there's no bumps or lesions on her legs. Her hair is normally distributed. Her skin is, again, warm to touch and color is right for her ethnicity. No signs of edema. And then I'm going to feel her pulse. Okay, and PDLS pulse. Okay, and then capillary refill. If she was wearing, if she had nail polish on, I have to check underneath her toes. And so capillary refill is normal. And then checking your pulse here. Okay. Now I'm just going to have you, I'm just going to check your lungs and your heart, okay? So this is her second intercostal space, right sternal border, and this is the aortic. This is her left intercostal space, or second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, herbs, fourth intercostal space, left sternal border, pulmonic, and midline to midline of her sternum is her mitral valve, and this is where I'm going to listen to her pulse for 1 minute. So I'm going to go through with my bell and then go back with my diaphragm. Okay, just breathe in and out normally. And keep it at the mitral valve for 60 seconds. Okay, and now I'm just going to listen to your lungs, 10 spots on each side, your front and your back. So first we're going to listen to the front. Okay, can you breathe in and out? Okay. Same thing. Okay, now I'm going to listen laterally as well. Okay. Okay, now I'm going to have you lie down and I'm going to just check your abdomen. Okay, do you feel any discomfort or anything? Okay. Do you have to go to the bathroom? Okay, so I'm gonna just check and make sure her abdomen is there's no abnormalities, no bumps or discoloration. Her skin is right for her ethnicity. There's no swelling or anything, and contour is normal. And so I'm going to listen first in her 4 quadrants. And I would have to listen here for 5 minutes in her right lower quadrant. And if I don't hear anything after 5 minutes, then I have to report that. Okay. And I would hear tympanic in all the quadrants except for 1. Okay, so now I'm just going to percuss. Okay, and then palpate. Okay, so her left upper quadrant is her spleen and her stomach. Her left lower quadrant is the ovaries. Her right lower quadrant is the kidneys, and the left upper right upper quadrant is the spleen and the stomach. The gallbladder and the liver. Okay, and now can you go ahead and stand? Her umbilicus is midline, and can you stand up for me? Okay, so can you close your eyes? I'd stand by the patient and make sure that she wouldn't fall, and she's good. Okay, so I'm just checking her balance, and then can you walk over there? I'm checking her gait, and her gait is normal and steady. She's able to hold herself up, and she's walking normally. Do you have any questions for me? Okay, so that's it.